three classes of hormones in our body. Amines, which are amino acid, proteins, and then the last one is your lipids. Yes, so cholesterol, specifically cholesterol. So cholesterol is the precursor for your sex hormone. So this is, by the way, this is the most simplified pathway of this for you guys. So cholesterol, with an enzyme, it becomes progesterone. And you know, this progesterone can become your cortisol and your aldosterone. And then it can become your androgens. Your androgens are a maximizing hormone. This androgen, further down the pathway, is when it becomes testosterone. And this testosterone can go one of two ways. It becomes what we call dihydrotestosterone, which in us guys is what causes male pattern baldness. Dihydrotestosterone. And the other pathway, it becomes estrogen. Specifically, estradiol, which is the most potent form of estrogen. Estradiol is the most potent form of estrogen. All right, with that out of the way, let's talk about some of the major hormones associated with the reproductive system. So that's when we talk about the hypothalamus, pituitary, gonadal axis. So we'll start off with the hypothalamus. What hormone involved in the reproductive system is secreted by the hypothalamus?
GnRH.
GnRH, gonadotropin releasing hormone. So the main thing I want to point out about gonadotropin releasing hormone is that the secretion of this hormone is based upon our body fat. So what that means is that if we have a good amount of body fat, then our body will start to secrete it. If we don't have a good amount of body fat, and then that will result in our body not secreting it. That's why these female athletes, these female bodybuilders, the one that has like a six-pack and everything, that's the reason why they stop menstruating after they like work out, train for so long. The reason is because they're losing all that body fat. So their hypothalamus is not secreting gonadotropin releasing hormone anymore. It's the same with these young girls too, where they're anorexic, they don't eat, and then they don't reach puberty. They don't reach puberty, they don't want to go menstruations because they don't have enough adequate body fat. All right, so the gonadotropin releasing hormone, what is the function of that hormone?
Go down the pituitary gland for SH and LH.
Yeah, the anterior pituitary, right?
Yeah, that's the one.
That's
the other one.
Yeah, so it stimulates the release of follicle-stimulating hormone and luteinizing hormone. So let's talk first about follicle-stimulating hormones in males specifically. What does it do in males?
Testosterone. Oh no, androgen binding football.
Yeah. So follicle-stimulating hormones in male stimulate the nerve cells in males. It stimulates the nerve cells. And the nerve cells are the one that secretes androgen binding proteins, specifically for testosterone, and inhibit.
So LH does extracellular cells to produce testosterone.
Yep. And so LH stimulates the interstitial endocrine cells. And they're the one that secretes testosterone. what about in FSH in female? Oops. It's supposed to be an E. What does it do in female?
Similarly, so,
Ovarian follicles,
yeah,
right?
so
It
those
stimulates the
little hairs,
growth
the
of
feathers.
the ovarian follicles. And what hormones does the follicular cells of the ovarian follicles secrete? Estrogen. Alright, good. So what about luteinizing hormone in female? What does it do? Someone help Mark out over here. Well, Mark running solo. What does luteinizing hormone do? Ovulation. It induces ovulation, thus forming the corpus luteum. In the corpus luteum, what hormones does the corpus luteum secrete? Progesterone. Good. And then going down to the gonads. So for males, the male gonad is the testes, and then the female gonads is the ovaries. Right? So we already talked about the female ovaries, the follicular cell, otherwise known as the granulosa cells. So is what is involved in secreting estrogen. And what does estrogen do? It's a feminizing hormone, right? So this is our feminizing hormone. Alright, and then there's the corpus luteum, which is essentially, again, the follicular cells that's been ovulated, the oocyte's been released, it secretes progesterone. And what does progesterone do? Acts in the uterus to prepare for pregnancy. Alright, in males, the testes has your, we already said has the interstitial endocrine cell, I just want to say IEC, so your interstitial endocrine cell secretes testosterone, and this is otherwise known as the masculizing hormone. And then you have your nurse cells, which secretes androgen binding protein, so the sperm cells can grab the testosterone. All right, with this out of the way, what is androgen insensitivity syndrome?
Is where your body doesn't produce any receptors.
Yes, so you are defective in the receptor for testosterone, right? So what will happen to the male?
They develop female secondary qualities.
Yeah, they're not, so essentially they don't have the androgen binding protein to bond testosterone, so they're not able to use testosterone at all, so they have very feminizing physique, a very feminized physique. What is congenital adrenal hyperplasia? What will happen if one of my pathways is messed up in the synthesis of my sex hormone? So the one thing I want to point out to you guys with the earlier class this morning too is look at the name of the medical condition. It'll kind of give it away a little bit whenever you guys learn pathology. So congenital is a baby. Adrenal, so your adrenal gland. Hyperplasia. What does hyperplasia mean?
It means growth of cells.
Yes, growth of the cells through cell division. So adrenal hyperplasia means that there's the growth of the cells in the adrenal gland. And what hormones does the adrenal gland produces?
So vague, isn't it?
Man, I gotta start doing the endocrine chapter along with the reproductive chapter, because there's a lot of hormones associated with the reproductive system. So the adrenal gland secretes, specifically the adrenal cortex secretes your mineral corticoids. So remember, the 3 layers, deeper you go, the sweeter it gets. So the outermost layer is salty, so mineral corticoids like aldosterone. The middle layer is your glucocorticoid, your stress hormone, and then the innermost layer is your sex hormone. So, if there is a mutation in the pathway of making your testosterone or your estrogen along the adrenal gland, so making the production of your sex hormone, then what will happen to, let's say, a female? So let's say this pathway is blocked, what will happen to the level of our estrogen?
Low or non-existing.
So if this way that is supposed to convert estrogen into your testosterone,
Yeah.
it'll go up, right?
Yeah.
And androgen, as we said, is a masculizing hormone. So if a female has this condition, then she will become very masculinized because she has a lot of androgen circulating around. If it's a male having this condition, then they become very, the term is virilization, so they become more manly. Yeah, so they become essentially more manly. So what you have, congenital adrenal hyperplasia, is due to a mutation of an enzyme in the synthesis pathway. Alright, good. Now that we get that out of the way, let's talk about the male first, because you know how us guys are. We're a lot more straightforward, right? Alright, so first thing I want to talk about the male is trace for me the path of sperm. Where it's produced, where it's stored at, and where it leaves the body. Now, starts in the testes, but what is the name of that functional unit?
Lobu?
So it's the seminiferous tubes.
Oh yeah, it's one spot.
So this is the site where sperm is produced. So from there, where does it go to next?
The Rita testes?
Yep, the recti testes. Alright, where to next?
Epidermis?
So it will be the efferent ductiles. So efferent away, ductiles, small ducts that leads away from the recti testes into the epididymis. So what is the significant about the epididymis?
That's where they mature?
Yeah, so it's where they mature and it's stored at. Alright, good. So from the epididymis, where else to next?
Deferens, ductus ferens?
Yep, or otherwise known as the vas deferens. So what is the significance behind the vas deferens?
We snip.
You get snipped in a vasectomy. Alright, from the vas deferens, where does it go?
Goes up to the spermatic cord and gets to eventually a gland that gives us fluid.
So it goes to the ejaculatory duct before it gets into the urethra. So what are the 3 regions of the male urethra? Yes, of the male urethra.
Talking about like an internal, external, or are you talking about where the, like, it passes by, like,
So what are the 3 regions of the male urethra? So you have your prostatic urethra, right? It passes through the prostate. You have your membranous urethra, passes through the ovourethral gland, and then it goes into your penile urethra. So through your penis and then out, right? So this is your prostatic. In the correct order is prostatic, membranous, and your spongy or penile urethra. Alright, speaking of which, so
Hey, I'm so sorry I'm late.
you're good. You fly over here with those aviators?
What's that?
No, I'm just kidding.
Oh, we had an incident with our chickens at the house, so.
No, I asked, did you fly over here with the aviators on?
Oh, thanks.
All right, well, good thing you brought that up. I forgot to mention that to students this morning. What is the name of that structure that found specifically in males that prevents the reflux of sperm into the bladder?
No,
Prostatic sphincter?
It's not the prostatic sphincter. There's only two. You have your internal and your external urethral sphincter.
So it'd be the internal one.
The internal one. The internal urethral sphincter is the one that prevents the reflux of sperm. And is found only in males. Alright, good. So while we are on that topic, what are the three accessory glands that are found specifically in males only?
The prostate gland.
Okay, so prostate.
It's on the tip of my tongue, I forgot it.
So you have your prostate, your vulvourethral gland, and your seminal vesicles. Yeah. Those are the three accessory glands found specifically in males only. What gland gets enlarged due to long and high level of testosterone? Prostate. So, essentially the point I'm trying to get at is both prostate cancer and benign prostatic hyperplasia, it enlarges because of testosterone and your dihydrotestosterone. So, is prostate found in females?
No.
No. So, female ever come to your clinic, Kara, saying I need a prostate exam?
Chart.
Yes, charge them for saying that, but that's not a thing. All right, so point I'm trying to get at is, what's the difference between prostate cancer and benign prostatic hyperplasia?
Prostate cancer is malignant and it has bad cells, bad DNA, and benign prostatic hyperplasia
Yep.
just does not.
So again, looking at the name of the medical condition, right? Prostate cancer is cancer, it's malignant. And then benign prostatic hyperplasia is benign, so it's not cancerous. All right, so again, how are we able to tell the difference between the two? Because let's see, both can cause bladder obstruction, urinary obstruction, if it grows bigger. Both causes the prostate gland to grow bigger. Both will cause an elevated level of PSA or prostate-specific antigen if you check the blood test. And both will feel pretty big whenever we do a rectal exam. So how are we able to tell the difference between those two?
There's labs.
What's that?
There's labs you can test for.
Labs, they mainly check the PSA, prostate-specific antigen. Both of them would be very high.
Oh, okay.
For both. The texture, cancer will be more firm, right?
No, so a rectal.
Yeah.
Okay.
So cancer will be more firm. So this is more firm, and this is more soft. Reason is because it's cancer. It's gonna be And the other difference between the two is that benign prostatic hyperplasia, the whole prostate gland gets bigger, the whole prostate gland. Prostate cancer, it only gets big on certain aspect of the gland that has the tumor. I mean, the tumor can grow and take up the whole gland, but it doesn't involve the whole gland unless the tumor spread itself. And the tumor, if you feel it, it's hard as a rock. It's literally hard as a rock. All right, so based on that, both grows by testosterone and dihydrotestosterone. So that's the reason why, you know, one of the medication to treat BPH is if you prevent the enzyme testosterone from becoming dihydrotestosterone. I think the name of that medication is finasteride or something. And then you can also prevent the guy from producing testosterone overall by preventing the release of gonadotropin releasing hormone, or prevent that hormone from working at all. Which, by the way, that's a medication they use in as puberty blockers. Irreversible. I just want to point that out. All right, back to it. Back to it. So we talked about pathosperm. So let's talk about puberty in adolescence in male. It's very straightforward. Puberty in male is essentially when their body starts producing gonadotropin releasing hormone to the first time they ejaculate. That's it. So that's essentially puberty in males. And then adolescent is essentially puberty all the way to adulthood.
So puberty has a start and so wait, does that mean that puberty ends at like 13 or something like that, and then adolescence is what's after that?
Puberty, based on the definition, ends until their first ejaculation and they have viable sperm. That's it.
Okay, but wait, does that mean that does this viable sperm come a lot after the first ejaculation, or it's about the same time?
I think it's kind of like a female. The female first menstruation is generally has no ovum at all. It's the same with male. Like the male first ejaculation, majority of the time doesn't have viable sperm. They mainly just have semen. That's it. So like the seminal fluid secretion, but that's it. They don't have any viable sperm at all. But I mean, like, who really checks for that? You hit puberty and then you start growing, you become an adolescent. Female is a lot tougher to classify, but male is a little more straightforward. But that's pretty much the difference between puberty and adolescent. All right, the next main thing I want to get at is the innervations of the male reproductive system. So you have innervation, which is mainly by nerves, and then you have your blood supply, which provides nutrition and wash away waste. So first things first, which artery supplies blood to the testes? Your testicular artery. Right, so your testicular artery supplies blood to the testes. Which artery supplies blood to the penis?
Dorsal?
Yeah, the dorsal. And there's another artery that supplies blood to the penis. It's the one that's involved in the male erection.
The spongy, I don't know what it's called, the
So it is
spongulosum.
found in the corporal cavernosum of the penis.
The item? Idiom?
It's the deep artery.
The what?
The deep artery.
Oh, deep artery.
Uh-huh.
Never mind. I'm thinking something branches off from that.
Yeah, penile artery, the branch of the penile artery. So, not to go into too much about it, testicular artery derives from the abdominal aorta. Well, right one, abdominal aorta, left one, testicular artery, from the renal artery. Or other way around. But one of it arrived from the abdominal aorta and one from the renal artery. The artery that supplies blood to the penis on the other hand, because it's technically a pelvic organ. The branches that comes off is the internal iliac artery, which gives off your penile artery, which divides into your dorsal artery, which supplies blood to the penis itself, and the deep artery, which goes into the corporal cavernosum, which is involved in a male erection. So the deep artery is involved in a male erection. Nerve innervation wise, the only thing you guys need to know is that it comes off the sacral plexus. And you guys remember what a plexus is, right? It's just a bundle of nerves jammed together. So mainly spinal nerve S2 and spinal nerve through spinal nerve S4 jumble on together. And that nerve give off the nerve that branches off is your pudendal nerve. And the pudendal nerve is what's carried the autonomic nervous system innervation to the penis. All right, so with that in mind, let's move away. Being a part of the autonomic nervous system, which is involved in the male erection and which is involved in the male ejaculation. Which part of the autonomic nervous system is involved in the male erection and which is involved in ejaculation.
Parasympathetic, along with, erection.
Yep, parasympathetic.
Because there's only one option for ejaculation. So.
Yep, ejaculation is the sympathetic. So why is the sympathetic nervous system involved in ejaculation?
Because point and shoot, that's our reason.
Yeah. So what does the sympathetic nervous system do to smooth muscle?
It relaxes.
It contracts
It
it.
contracts.
Yeah, so sympathetic nervous system contracts smooth muscle. So it squeezes in kind of like a toothpaste, right? It squeezes in the smooth muscle in the vas deferens and the epididymis and the vas deferens to squeeze all that sperm out there. So that's why it's involved in ejaculation. What does the parasympathetic nervous system do to blood vessels? It relaxes them. Yeah, it relaxes them and dilates them. So the only way for a male to get an erection is if you have blood pulling into the corporal cavernosum. And the only way to do that is to pull blood into your deep artery. So, and the way it does that is by way of the parasympathetic nervous system. All right, good. So the last one is the way the parasympathetic nervous system causes relaxation or dilation of the blood vessel. Do it here. The way the parasympathetic nervous system is that it triggers the release of nitric oxide. So our blood vessel has chemicals in them, and one of the chemicals is nitric oxide. Nitric oxide results in dilation of blood vessel. That's how the parasympathetic nervous system causes dilation of blood vessel, by utilizing nitric oxide. Nitric oxide trigger the formation of what's called cyclic GMP. And cyclic GMP is what results in dilation of the blood vessel, otherwise known as vasodilation. There's an enzyme that breaks down cyclic GMP. And that enzyme is called phosphodiesterase. Phosphodiesterase is the enzyme that breaks down cyclic GMP. So what happened if we prevent this enzyme from working?
The erection continues.
Yeah, so the level of cyclic GMP will increase, right? Because it will prevent the breakdown of cyclic GMP. So your level of cyclic GMP will increase, prolonging the erection because of vasodilation. So that's what your erectile dysfunction medication do, like the magic blue pill, Viagra, Cialis. I don't think Cialis is blue, but that's how Viagra and Cialis work. They are classified as a phosphodiesterase inhibitor.
Do they cause any other like weird side effects?
Oh yeah, imagine your blood vessel being dilated everywhere else in your body. What do you think will happen to your to your blood pressure?
Oh dear.
It'll
Lowers.
tank. Yeah, it'll tank. That's why they tell you to, sorry, not to mean to. So that's why they say older people where the blood pressure, you know, doesn't respond very fast already. Now they're taking Viagra, that's why their blood pressure even lowers down even more. And if the blood pressure is so low, what do you think will happen to your heart?
Your heart will speed up.
Your heart will speed up. So what happened? Kind of put it all together. If your heart speed up, your heart is pumping a lot more. When does your blood vessel to the heart get fed with blood? Remember the coronary arteries?
During relaxation.
Yeah, the coronary arteries get fed with blood during the heart relaxation, right? So now that the heart is speeding up even more, there will be less time
So
during
maybe like
relaxation.
chronic use of Viagra can cause like other issues, like later on down the line, like systemic issues.
It can over time causes a problem with the heart. Yeah, because you know it increases your heart rate so much that over time, your heart doesn't get fed with blood by what the coronary artery. Because remember, the coronary artery only gets blood flowing through it whenever the heart is relaxed. So during diastole. So if you decrease the time of diastole, then there will be less blood flow to the coronary artery. And the thing about Viagra is that it causes it changes the color of your vision. It affects the cones in your eyes too. So it can affect your vision. It causes you to see blue. So you decrease color vision in other color, like red and green, so you see more blue. So that's one of the long-term side effects of Viagra. Alright, otherwise, that's pretty much the main thing I want to talk to you guys about male. So what